Hi guys, welcome to my YouTube channel. It is your South African professional nurse Z. Guys, the person that's holding this camera, whatever. But anyways, today we are talking dolutegravir again. Mainly because on the previous video that I did on dolutegravir, I was actually talking about the advantages of dolutegravir and why you guys should go out and use it. And at the end of that video, I did mention it causes neurotubal defects on first trimester of pregnancy. So I don't want to say we don't give it to females who are on childbearing age, but I want to say females who are planning to have children, it's not advisable to use dolutegravir. So in terms of females who are on childbearing but they don't want to have babies or anything like that, then it means they must use contraceptives that is reliable. Anyways, on here I have the consent form that we normally make women on childbearing age sign. This consent form, it simply says that me as a registered nurse or me as a healthcare provider, I have explained to you what are the effects of dolutegravir in pregnancy and what you need to do as a woman, or your responsibilities, the part that you are gonna be playing. So on here it's a checklist for the prescriber, and then on here it's a checklist for the patient. So I want to start with the prescriber being the healthcare provider. Ne? Okay, so you have to explain to them that what can dolutegravir do in first trimester, and also give them an option to say if you are not going to use dolutegravir, if you are planning to have other pregnancies, then definitely don't go for dolutegravir, but go for efavirenz, which is the other fixed dose combination, the one that we've been using, your Atroiza and all those other drugs. And then it says that dolutegravir needs, I think this is very important, an effective contraceptive. Personally, what contraceptive would I suggest? I would suggest one to use Implanol and IUD. Ne? If you are a very disciplined person, you are not like me who takes contraceptive pills only when they are going to see their boyfriends. If you are sure that you are a disciplined person, you can also use the oral contraceptives. You can use your injections as well, which we have Depo, which is Petogen, as well as Nestrate. And it says the need for up-to-date information on risk and benefits of DTG, and also alternative antiretroviral options. That is us telling you, okay, you have two options, you have efavirenz and you have DTG, which one do you want to choose? So the choice at the end of the day, it's not made by the healthcare provider. The choice has to be made by you as a patient, and the healthcare provider must not withdraw the information, certain information, because you will end up not making an informed decision. Ne? So take time to also investigate for yourself. And investigation, I don't mean go on Google, guys. You can go to your nearest clinic and ask questions. And then they're saying the need for regular pregnancy testing and review contraceptives. So those who are not trustworthy, I know there are a lot of patients that even if you give information, they still do the same thing that you ask them not to do. So as a healthcare provider, it's very important for you to test the woman for pregnancy. I think we can do it every time the patient comes to collect their treatment. Yeah. So every time when the patient comes to collect their treatment, I think it would be very wise for a healthcare provider to do a pregnancy test. But these patients can be, they're not trustworthy sometimes. And then, anyways, they are saying that again we have to do a pregnancy and also regularly check with the woman. Do you still want to have a child after 10 years? Do you still don't want a child, or you've changed your mind? Because sometimes the patient will change their mind with their husband. Let me say I'm single right now and I am certain that I don't want no baby, and then tomorrow I meet a cute handsome guy that has all the monies in the world and wants to marry me, and this guy wants a baby. Of course I'm gonna change my mind. So go back again to the clinic and tell the sister, you know what, Sister Sanele, I've met the love of my life and I want a baby now. Okay, you don't just go and have a baby, because your child will come with certain things that the love of your life will not be happy about. And then they are saying mothers who are breastfeeding their infants might not wish to use DTG. Might not wish. It's not a must. They are saying might not wish to use DTG because DTG is expected to be excreted in breast milk. To be honest, I just heard this or saw this today. When I went for my training, I didn't hear. I don't know if they didn't say it or I just didn't hear it. But yeah, I just went and confirmed with one of the sisters here in my clinic, and she said that the training that she went to, they did mention it. But the one that I went to, I was one of the nurses that were trained when DTG was coming in. So maybe even my trainer did not have enough information, and as or Nazang and Divi, I don't know. But yeah, I only saw this today when I was preparing for this video. So the nurse that was telling me, she was saying that, so okay, before that, on my training, they were saying that it's best to give DTG to women who are on second trimester and third trimester and who are having high viral loads, because DTG is dropping the viral load very fast. I guess that's the reason we love it so much, because it suppresses the virus very fast. So they were saying we must give it to women who are pregnant and who are on second and third trimester, so that we can drop the virus very quick before the baby can come, because babies do get infection during delivery. Okay, so once it's dropped the viral load, the baby chances of getting the virus are minimized. So I didn't hear the part where they're saying women who are breastfeeding might wish not to use DTG. So when I saw it, the sister says that you initiate the woman on DTG, and then after the woman deliver, okay, you obviously have to discuss with the woman the method of feeding. Okay, if the woman chooses exclusive breastfeeding, which is formula, you can give DTG, the woman can continue with DTG. But if the woman chooses that they're gonna do exclusive breastfeeding, then it means the woman must exclusive breastfeeding, it is right, it's giving milk only, yeah. So if the woman breastfeeds, then you have to change DTG, you have to switch DTG and give the woman efaference, because the DTG will go into the baby. The baby will also drink the DTGA from the milk, and the baby might not be HIV positive, so we don't want babies drinking DTG. And it also says that as a healthcare provider, they are emphasizing, guys, as healthcare providers, I don't care if you are a medical practitioner and this patient is paying with medical aid and you're thinking this is gonna give you money, blah blah blah. Guys, let's not play with people's lives here. These are people's lives, so let's give our people the correct and the right information. Let's not withdraw anything. Let our patients make an informed decision, a decision that has all the details in it. Okay, let patients not go on Google or go on YouTube channel to find out something that you could have told them in your consulting room. Here they are emphasizing that you did give the woman her options, and you did give all the information that is needed. Now I want to do the checklist for the patient. They're saying that as a patient, check that you should avoid pregnancy. So the last thing that you need is a baby that has congenital abnormalities, because living with a child that has congenital abnormalities, it's not an easy thing. So a lot of parents who are having kids that have congenital abnormalities will tell you how much they are struggling. So make sure that as you have planned with your healthcare provider, you are not gonna have a baby, you are not gonna fall pregnant. It is not our responsibility as the clinic or as the healthcare providers to make sure that you don't fall pregnant. If the clinics don't have injections, go and get them at Clicks. 90 rand. Yeah, I think it's 90 rand or something like that. So please go and get them at Clicks or at private pharmacies. Don't just stay and say, hey, I got thinking, guys. And then it says that there might be slightly greater risk to an unborn baby whose mother falls pregnant while taking DTG. Okay, one study found a higher rate of neurotubal defects than normal in babies whose mother became pregnant on DTG. So you're hearing it. It says the ones whose mother fall pregnant while they were on DTG, those are the ones that ended up having neurotubal defects. This was before the babies were conceived. So you took the drug before the baby could be conceived. You promised the nurse that you are going to be faithful to your contraceptives, but you lied. You didn't stick to your promises. Patients have rights, okay? but also patients have responsibilities. And I think that is what kills us as a country. Our patients know nothing about their responsibilities. So this is what you guys are going to deal with if you continue to ignore your responsibilities. They're saying neurotubule in a developing baby is what becomes the brain, spinal cord, skull, and spine. The neurotubule closes in the first 28 days of pregnancy. That is before most women know they are pregnant. So are you seeing that? You won't even know that you are pregnant because when you didn't go for your let me say monthly injections. You did not go. You don't even know that you are pregnant. That's when the brain is being formed and the spinal cord is being formed, and it means your baby will have abnormal spinal cord, abnormal skull, and these are like the important parts of the human body. I mean, the brain is the one thing that operates everything. So guys, you need to be very careful. And then it also says that as a woman, you need to know and be reliable in terms of taking your contraceptive. My treatment as a woman, pregnant status and contraceptives should be reviewed regularly. You know, when they're saying reviewed regularly, I think every time when you come for a visit, you must ask questions. Are you pregnant, or screen for pregnancy, and also check when was the last time you took your injection. So continuously discuss those things with your healthcare provider. Okay, discuss them. If you see that the healthcare provider is not initiating the conversation, you initiate it. I always tell my patients that sometimes they would get in my consulting room, and on that day I'm like exhausted, and all I do is just write notes. And if they have a question of something that I am not asking, they have the right to ask. That is not being annoying, guys. Stop keeping quiet into consulting room, especially when you are consulting with doctors. Hey, let's have a doctor. Why are you so scared of doctors? Guys, ask doctors questions. Don't be scared of them. You know, you send a patient to a doctor and then you come back and you ask them, what did the doctor say? They say, I don't know. Hey, that part kills me. Guys, stop it. Okay, ask your doctor questions. If he's not giving you the information, ask. Okay, so they're saying you must make sure that your contraceptives, your HIV status, your pregnancy status are reviewed. Not HIV status, but your treatment, they are reviewed regularly, right? And then you should request an agent review of treatment if planning a pregnancy before attempting to conceive. So you don't go and sleep with the love of your life and then come back and say Nna ke batla ngwana, while you know what you did last night, because it's already too late. So when you know you and the love of your life, you've planned something, you come and tell me, Sister Zanele, this is what's happening, blah blah blah, we've planned this and that, and then I change the treatment, and then you can go and do things with the love of your life. If I'm planning to become pregnant or I'm breastfeeding, that there are other treatment options available that may be better suited for me. I saw something on Young Nurses Indaba group where Fikile, the fixer, that's what I call her, she's a leader at the Young Nurses Indaba, and she was talking about how she feels that this treatment is gender exclusive. I think she said something like that. I'm not sure. I'll try to find the post and pop it up somewhere here. She said the treatment is gender exclusive, and in a way I think I agree with her, but at the same time I realize that we can't decide for patients. So here they're saying that you also need to know that you have other options besides DTG. There are also other drugs that are good, that have been there. Just because today we brought something better, it doesn't mean those ones now they are not functional, they're not doing their job. Okay, so muni warning. And then the last one, it says, I have been advised to receive a copy of the patient's information leaflet inside the DTG. You guys don't read those things. We know. You saw those. You see these leaflets. I don't have one here. Yeah, I don't have one. Oh, there's one here. You guys, you don't read these things. These leaflets, you don't read them. Read them. Stop reading Google, because Google does not give you the correct information. You get all your correct information here. Uguti, what is the drug made of? How does the drug get absorbed in your system? Why should you take the drug? What is it contraindicated for? So also with DTG, request your nurses to give you the pamphlets so that at your own time you can read it for you. And if you can, you can read it for yourself. But if you can't read, you can get someone that can read and read to you. Or you can even ask your healthcare provider to say, Sister Mtetwa, can we discuss this? You get what I'm saying? Can we discuss? Can you explain to me? That's why we went to school. We didn't go to school for ourselves. We went to school for you guys. And then, yeah, you must get the leaflets. That is the information that I have for you guys. So if you are a woman and you are being put on DTG, you are going to sign a consent form, my sweetheart. This is the consent form that you are going to sign. So this is to say, as a healthcare provider, I've explained everything that I needed to explain to you, and you still chose DTG, and you have agreed that you will do your part as a patient. You will take your responsibilities serious so that we can have a healthy you. And when you want a baby, we also do the correct thing so that we can also have a healthy baby. Thank you so much for watching. I love you all so very much. If you are new to my channel, hi, welcome to the Nessie channel. Please do hit the subscribe button to be part of the Nessie channel. I love you guys so very much. But we are on road 1K, okay? We are a few subscribers away. So even if you don't like this content, just subscribe, man. You will see. Maybe one day we will post something that you like, okay? Bye.